Hi guys, welcome back. We're gonna talk about hypothyroidism. Now, what is the meaning of hypothyroidism? Hypo means less, thyroidism means less amount of thyroid hormone. So, what are the thyroid hormones in your gland? In your body is actually your T3 and T4. So, if I'm having less amount of T3 and T4, then you can say that I'm having hypothyroidism, right? So, approximately around hypothyroidism is 6 times more common in females as compared to males, right? So the main thing is that what is the symptoms of hypothyroidism? What are the symptoms? Now, if you start from the top part, right? If you just go in a systematic manner, you can say that the hair will become thin out. Hair will be getting thin out. The second thing you'll be saying, you'll be having attention disorders. You cannot pay attention, right? Next thing, if you see that you'll be having facial puffiness. Very important. You'll be having facial puffiness. Now then, you'll be having dry skin, right? If you come down, you might be having a swollen thyroid gland, right? With this, if you come to your heart, you will be able to see that you might be having a slower heart rate. Now, if you are a female, you will be having irregular or heavy menses. You will be having a longer menstrual cycle, right? The period will be longer, more amount of bleeding will be there. With this, you will be having joint pain. Along with this one, very typical is that you will be very slow. You will be very lethargic. You will be very slow. You will be tired, right? Along with this, you will be having. It's a very typical this one, right? You will be having less appetite. You are eating less, but you will be gaining weight. So this is a very typical. You will be eating less, but still will be gaining weight. So eating less appetite, eating less but gaining weight, female, irregular bleeding, you will be having thinning of hair, weakness, slow, lethargy. Uh, these things, these things will tell you that you are having hypothyroidism. So remember, you cannot have the symptoms all the time. It does differ with the severity of symptoms, right? It does differ with the severity of the symptoms. So if you're having any of the symptoms, go and get it checked. Even if you don't have the symptoms, go and still get it checked, man. Like you need to be doing certain kind of medical checkups at least once a year. What are you supposed to do? Go and check your eyes. You might be having glaucoma, you might be having visual disturbances. Second thing, you should go and check your liver function test, kidney function test, very important. Along with this, go and do your complete blood count, very important, right? Thyroid profile test, very important. If you're a male a bit older age, do go and do your prostate specific antigen. If you're a female, do pap smear, right? Or do mammography. These two things are very necessary, right? Along with this, you should be going and get your blood pressure checked. It's very important. Blood pressure has to be checked by a doctor. Or you can go and check also your diabetes mellitus. If you're having, what is your blood sugar level, very important. And then go and get yourself auscultated, your lung feel, how is your lung sound, how is your heart sound. So these are the bare minimums that you should always do for a medical checkup. Because see, even if you're having any sort of liver disorders or kidney disorders, you will not get the symptoms. If your condition is very severe, that time you are going to see these symptoms. So you should not rely on the symptoms of these two organs, liver and kidney, right? Along with this, you can also include your urine test, right? Urine routine microscopic examination. They're going to see for any pus, they're going to see for any blood coming out, they're going to see for any protein leak, and your stool examination. What in stool they're going to see? In stool, again, they're going to see for, is there any vegetable cells coming out? That means your digestion is not working very properly. Or you can be able to see, is there any blood, right? Is there any mucus, or is there any parasite? If there's eggs, right? So these are the things that you should be doing. It is not expensive, guys. It's like, it's very cheap. If you just compare this with your a patient who has diagnosed with a disease, it's nothing in front. Because that is the reason it's told that health is wealth, right? Why are you earning so much of cash? To have a healthy life, to have an amazing life, go move here or there, all these things, right? So eat food, whatever. So these are the things that you should be making sure that your health is in perfect order. And just to summarize, hypothyroidism, yes, it is common if you're female. Guys, males can also have it, but a bit less chance. But females, hypothyroidism is very common, right? So do yourself a favor, go and get it checked at least once a year, right? And look out for the symptoms, but don't rely on the symptoms, because these symptoms are not always going to appear. It depends on the severity of the disease. So if it is severe, you can have more symptoms. If it is mild, you might not have any symptoms. And sometimes the symptoms are not specific, right? You might be just tired, you might be having irregular bleeding, so you might think, yeah, it's normal, right? So sometimes some symptoms are not very specific. That is the reason investigation comes into play, lab diagnosis comes into play, imaging like X-ray, MRI, CT, all these things comes into play, right? Everything cannot be done with the symptoms only, right? Most of the things can be done with symptoms, but if you're confused, go for the investigation. These are for your help, right? Okay, so that's all for now. Thank you. I'll see you in the next video. Bye.